A lot of people don't fully understand what happens when an aneurysm ruptures. So the first thing that happens when an aneurysm ruptures is that there's release of blood and the pressure inside the brain goes up very dramatically. And that's when the patient has all those dramatic symptoms like headache and nausea and vomiting. After the brief period that the aneurysm ruptures, it generally forms a little blood clot there so that it stops bleeding. And that's usually the point that we get patients in the hospital. But there's a lot of things that can happen from that point. The most urgent problem is that the aneurysm can rupture again. So usually the first thing we want to do is to fix the aneurysm either through a catheter like I described or through a surgery. But even after we successfully get rid of the aneurysms, there's other things that can happen. Those things include seizures, for which we give medications. We can get people who develop water on the brain because the normal pathways that our brain makes cerebral spinal fluid can be blocked. And sometimes we have to put in a catheter to actually drain some of that fluid. But the most dangerous thing is something called vasospasm or cerebral vasospasm. And that's in a delayed fashion when the blood vessels of the brain begin to constrict due to something associated with the hemorrhage. That's actually the leading cause of people having strokes or other problems after an aneurysm ruptures, and that's where we made great advances. So now we can give medications for that. We can actually put catheters up into the brain to take a balloon to break up those places where the blood vessels are contracting. Sometimes we can put in stents and other things. So we've really made great progress in treating cerebral vasospasm.